morning and welcome everyone. My name is Hailan. I'm a physician assistant working in the surgical oncology side. I work with Doc Pharma's team and we see a lot of melanoma patients. I also runs the melanoma survivor clinic here on Tuesday afternoon, and usually I see the early stage melanoma patient most. So the topic of my talk today is regarding melanoma survivorship. And before I start, we'll start with a short video clip.
Okay.
You never stop dealing with cancer. It's always an ongoing process. I'm a different person than I was before. I take each day as it comes now.
Once you've had cancer, you have cancer for a lifetime. So you learn to deal with it every day. You try not to let it consume you.
Getting back to the living has been the most challenging because of the fear of recurrence. I don't have the luxury of having an ache like anyone else might have and think, oh, it's just a headache, it's just the flu.
I think I'm a realist. I've had cancer 4 times. I've had the treatments for those, and I know the repercussions. During active treatment, you do receive a lot more support. And when you're done, people just assume that, you're done. It wasn't like I'm done. I wish it were.
After all the flurry of treatments and running back and forth to the doctor, it was almost like a ghost town in my life. The tumbleweeds would go by my house, and I would stand outside and say, okay, where's everybody? It's a long, long, long race. It's not over just because you finished treatment. You're not going back to your old life. You're going back to the unknown.
Historically in medicine, we've focused a tremendous amount of attention on getting the patient through the acute phase of the cancer, getting them cured. To a certain degree, patients end up being left out in the cold after their treatment is all finished. The physicians need to go on to other cases who need the care more acutely, and the patients are left to deal with all of their issues really without much guidance and without a lot of experience from the medical community.
Everybody talks about, treating the cancer. What they don't talk about is, now that the patient's been treated, then what do you do?
You'd like to think that patients just go about their lives and return to absolutely normal lives, but it turns out they don't.
The impact of this Institute of Medicine report can be that for the first time there's a wake-up call issued. We are doing much better in the war on cancer, and it's time to recognize that there are things that we can do to help the quality of life for patients who are surviving after cancer treatment.
So this is, in fact, a study published by an institute in early 2006. And it's, I think, with the notion that when our cancer treatment becomes more and more effective, and cancer patient lives longer than we expected. And we realize not only patient, but also the healthcare provider that treatment of the patient is not only their cancer, not only the care of their cancer, but the long-term effect that cancer diagnosis have on patient, emotionally, physically, financially. And the effect is not only on them, the cancer patients, but also their family, their caregivers, and their friends. So before I start talking about cancer survivorship, we need to first define who is cancer survivor. So I think most people will probably agree with the first 2 definition most. And some patients say, as long as I finish my treatment, my doctor told me I'm fine, I don't see any recurrence in your skin or your blood work looks fine, then I'm a survivor. Some were more cautious, saying that when my oncologist discharged me, I'm a survivor by that time. I think very little patient will realize that they're a cancer survivor from the day of their diagnosis. And more or less everyone will have this notion of that, what if my cancer recur? So I think there's no right or wrong answers, and that is what makes cancer survivorship care a more complicated issues, because everyone has different ideas, and we take care of every patient individually. So according to National Cancer Comprehensive Network and NCCN guidelines, an individual is considered a cancer survivor from the time of their diagnosis. But this is not a point of time of the survivor starts. So survivorship care is throughout his or her lifetime. And so that's why cancer survivorship care is not just the time that you are coming here to see your oncologist. It goes beyond that. And your family members, your friends, your caregivers are all affected by the cancer, and they also need to know about cancer cares. And because cancer survivor care is a lifetime process, so taking care of cancer patients is no longer just treating their cancer. That's one part of the cancer survivor care. There's also surveillance of cancer spread, cancer recurrence, or secondary cancer because of the diagnosis of your cancer. And there are also issues with late effect of cancer treatment. Some of the treatment leaves lifelong debilitating and side effect for patients. And so we need to intervene of these issues. Cancer patients also, because of their treatment, they have issues emotionally, they have psychosocial issues, they have financial issues that need to be taken care of. And so that makes cancer survivor care more of a coordinated care between many specialties, not only your oncologist, but also, for example, for melanoma patient, your dermatologist, your primary care doctor always, and other healthcare lines like social works, or nutritionist, or lymphedema physical therapist. So I think this is a picture really depicts the complicated care for cancer survivors. So besides your cancer and the physical issues that's related to that, we need to take care of also your psychosocial issues, the financial issues, and spiritual issues. So since we are here, we are talking about melanoma. So what's specific about melanoma survivorship? So let's first get an overview of melanoma so we have a base to talk about. And according to American Cancer Society, so the estimation in 2018 is that more than 90,000 of new melanoma will be diagnosed, and about 9,000 people are expected to die because of melanoma. Unfortunately, men are more susceptible to the diagnosis and the consequence of melanoma. The rate of melanoma has been rising over the last 30 years, and median diagnosis age is usually around 63 years old, but that doesn't mean we don't see younger patients with melanoma diagnosis. So the risk factor for developing melanoma, UV exposure is always one of the biggest factors. A sunburn significantly increased your risk of getting a melanoma, and especially the blistering sunburns and sunburns that happens in the younger age. And if you are someone with a lot of moles, especially the dysplastic nevi, the ones that behave a little bit different from the normal mole, you are with a higher risk. And people with fair skin and light hair, easily freckling, have higher chance of getting melanoma. If there's a family history of melanoma, and patients do have an increased risk of getting melanoma. Also personal history of skin cancers or melanoma increase the risk. And age and being a male also are risk factors. So melanoma staging are something that's important because that dictates the surveillance, treatment, and the later care. So usually stage 1 melanoma are the ones that's thin, so it just started to invade. And stage 2 melanoma are what we call intermediate. So they are a bit thicker, but haven't goes to the lymph node yet. So usually for stage 1 and stage 2 patient, surgical resection is the primary method of treatment. Some patient may need a sentinel lymph node biopsy, meaning that taking out the guarding lymph node to make sure that melanoma did not spread into the lymph node. And that's usually determined by how deep the melanoma is and if there's any other high-risk features. And so when a stage 3 patient has a melanoma that's already spread into the lymph node, so usually those patients needs not only the surgical care, but also medical treatment to prevent later recurrence and metastasis. Some of them may have a surgical procedure called completion lymph dissection, meaning taking out all of the lymph node at the lymph node basins where their melanoma spread to. And there will be consequence of this. Some patients suffer lymphedema because of the lymph nodes taking out. For stage 4 melanoma, that means the patient has melanoma spread to other part of their body, inside organs, their livers, their lungs, the brain. So those patients are usually on medical treatment. And recent years with the development of immunotherapy, we've seen great success of melanoma being treated in patient even with stage 4 disease. So for melanoma survivors, what we need to take care of are to treat their disease. That's number one goal when they have the newly diagnosed problem. But we also need to survey for recurrence. And patients have higher risk of developing a secondary melanoma, so they need surveillance for that. And we always educate regarding the risk behavior modification. And for melanoma patient, sun protection is number one. So management of long-term effects, such as lymphedema, as I mentioned, or the side effect from immunotherapy, targeted therapy. And also, patient needs surveillance for other cancers. So when we talk about risk of recurrence, usually it depends on how thick your primary melanoma is, whether or not there are ulceration, which is a high-risk features in the primary melanoma, whether or not there's a satellite lesions, meaning that your main melanoma break off and started to implant into the nearby regions of the skin, whether or not there's high mitotic rate, meaning that your melanoma are kind of actively replicating. And the recurrence can be presented as several different forms. It can be local recurrence, meaning where you had surgery along that scar, you have a new melanoma, like you have melanoma present. It can be a satellite, meaning the melanoma was near your resection scar. It can be an intransit nodule, or sometimes it can be a little bit further down. Also, recurrence can occur in lymph node. So all these affects our surveillance. So during your clinic visit, we always check your scars, check the surrounding areas, and check your lymph node basin. And when you see your dermatologist, they always look the scar, check your lymph node too. Besides that, they will also look at your whole body to make sure there's no new melanoma that's coming out. So most of the recurrence occurs within first 3 years. So early detection means that we can treat the problem earlier. One thing to keep in mind for melanoma is that there is late recurrence in a small portion of patient. Some of the recurrence happens 5, 10, or even longer after the diagnosis of the first melanoma. So the teams that's involved in melanoma surveillance, including your surgical oncologist, your medical oncologist, and your dermatologist. So for stage 1 and stage 2 patient who usually just undergo surgical treatment, the surveillance will be in between your surgical oncologist and your dermatologist. Well, for stage 3 and stage 4 patient who needs treatment, your medical oncologists are also part of the team. And for stage 1 and stage 2 patient, usually there's no routine imaging studies or blood works that's useful for a survey for recurrence. So it's just clinic visit, and we ask questions to see if there's any concerning symptoms, and then do a physical exam. But for stage 3 and stage 4 patients, you do have routine imaging studies according to the NCCN guideline. And another big issue for melanoma patients is that the diagnosis of melanoma increase your risk to get a secondary melanoma. And we always quote there's about 10% lifetime risk of getting another melanoma. That's about 9-fold increase compared to the general population. So that's why we always recommend patients to see your dermatologist at least twice a year. And I think Dr. Santoro will talk about skin surveillance when he's giving his presentation. So for risk modification, so because melanoma, we know UV exposure is one of the biggest factor. So sun protection is one of the important things for a melanoma patient. Several points, avoid outdoor activities in the middle of the day when the UV ray is the most strong. So usually that's in between 10 a.m. to 4 p.m. If you have to be outside, I mean, you have to enjoy your life, and outdoor activity is something many patients likes. So try to seek shade and avoid direct exposure to sun. Always cover up with either long sleeve t-shirt, long pants, wear a white brim hat, and sunglasses that protects your eyes. And I think now there are clothing that's specifically made with a UPF rating. So they have special fabric that reflects the sun ray and gives a better protection. So some of the patient may be a runner that they go out to run every day, and it's probably easier to wear that shirt compared to putting on a lot of sunscreen. And sunscreen is one of the most important things that most people should use. And usually we recommend a broad spectrum sunscreen, SPF 30 and above, on all of the exposed skin. And I will talk about like sunscreen application in a minute. And the other thing is no tanning. So when you go to the beach, I think don't suntan. And the most important, tanning salons and tanning bed are the worst that you can use for tanning. So this is a busy picture. So talking about how we choose sunscreen and how we apply it. So when you have a sunscreen bottle, look for a couple of important information. So first on there, it should say broad spectrum. So that means it protects not only the UVA ray, but UVB ray. So UVA, usually I think of it as something called aging, and UVB is the one that causes burn. So you want a protection of both so that you don't get sunburn and you don't get sun damage and causing wrinkles and freckles down the road. The SPF factor is one thing you need to look at. Usually SPF 30 and above is what we recommended. And the other thing is here, it need to say water resistance or very water resistance. So usually if it says water resistance, it means that it can last about 40 minutes to give continuous protection. And if it's very water resistant, it's about 80 minutes protection. But that's in the case of that you are not profusely sweating or you're not in the water. And if you are sweating, so you need to reapply more often. And if you're in water and swimming or at beach, when you come out of the water, you need to dry up and reapply sunscreen again. So how much sunscreen should you apply? So, So most people don't put on enough sunscreens. I myself is guilty of that. So usually they ask, it's recommended for 1 ounce of sunscreens for the whole exposed areas. That's usually your arms, your legs, and your body. So that's how much it is in 1 ounce. And I don't know if many people are applying that whole palm of sunscreen yourself before you're going out. So this is more of a visual pictures showing you. So 1 ounce is about 2 tablespoons. And for your face, it's about 1/4 size of sunscreen that you need to apply. So that's a lot for most people. And usually consumer report every year before summer put out a report about the best sunscreen that they tested. I think you need to buy their subscription, but usually if you Google consumer report best sunscreen of the year, and there are different news that's broadcasted, so you will know which brand you can try. And there are also other things regarding sunscreen. I'm sure some of you probably have questions. For example, there are people asking, what's the physical versus chemical sunscreen? And so we can touch those topics later in our Q&A sessions if some of you have questions. And so the other thing that surveillance and care for melanoma survivor is taking care of lymphedema. So it is a side effect from the surgical removal of the lymph nodes from your lymph node basin, either under the arm or in your groin area. So lymphedema is the swelling of the extremity. So if you have a lymph node removed under your armpit, you may have swellings on the same side of the arm or in the chest region. If lymph node were taken out from groin areas, then you can have swelling of the lower extremity, your legs. And lymphedema can be painful. It can be very debilitating because some patients, when they have swellings, it affects their mobility, affects their normal daily activity. So usually for patients before they undergo melanoma, lymph node resection, we will send them to our lymphedema physical therapist for a pre-op evaluation. And afterwards, if they do present lymphedema symptoms, they will go back to our lymphedema PT to do physical therapy. So there are ways, there are compression stockings, there are massage, and there are exercises that patient can use to decrease the symptoms of lymphedema. There are now here, I think, our plastic surgery teams are working on ways, surgical interventions of lymphedema who's really significantly affects the life quality. So they can graft your lymph channel into the vein to make sure that the drainage is going, or they can transfer lymph nodes from other part of your body to the area that causes lymphedema. And so you can talk to your doctors regarding if that's a choice for you if you are suffering from lymphedema. And some patients develop lymphedema shortly after surgery, but not everyone does. Some of them present lymphedema later and can be years after their lymph node taken out. So with a new onset of lymphedema, we always want to make sure, because it's one side swelling of the extremity, we want to make sure that you don't have a clot in that extremity that's causing the symptom. We also want to make sure that there is no recurrence, because sometimes melanoma recurrence can present as lymphedema. So I think Jen from our PT department will talk more about lymphedema physical therapy. So I think it's about over a decade now that immunotherapy for melanoma has been used in treatment of patients with advanced melanoma. And it has been giving us great success, and we've seen patients that has spread of disease respond to this treatment, and they are years after the treatment still without signs of any new recurrence. And so the mechanism of immunotherapy is to ramp up your immune system to attack cancer cells. But because of this ramping up of immune system, it can also overactivate and attack our own body cells. And so some of those side effects of the immunotherapy are in fact because of these immuno attack of our own body cells. And so it can be a transient during your treatment. Some of the effect can be lifelong. So that need to be followed and managed by medical specialists. And Amanda from our medical oncology side will touch on this topic in more details. So when we have a diagnosis of a cancer, that is always something that preoccupies your mind, and especially when you are in active treatment and surveillance, that is always something that you want to take care of first. But that shouldn't replace and shouldn't hinder care, routine cares for patient. It's not uncommon that we see patient that's being treated with melanoma develop another cancer because they haven't really taken care of other routine cancer surveillance. So for female, usually mammogram, pap smear, and colonoscopy at different age are what we recommended. So usually mammogram starting at age 40, based on USPSTF guidelines, in between 40 and 49, you have a baseline. And then from age 50 to 75 is usually one mammogram are routinely offered. Pap smear starts at age 20, and there are different guidelines for that. And colonoscopy used to start at age 50, and I think this year, American Cancer Society started to recommend colonoscopy at age of 45. So for male, prostate cancer screening with PSA is what we recommend usually, and also colonoscopy for colon cancer screening. So besides the treatment of cancers, there are also other things that need to be taken care of for melanoma survivors. Nutrition is very important. A healthy nutrition helps you recover from surgery, from medical treatment, and also gives a lifelong benefit of better health. And Tara will talk about nutrition for the patient and exercise. So the recommendation now is 150 minutes a week of moderate aerobic activity or 75 minutes of vigorous aerobic activity. And many times when you are on treatment and patients feel really tired, they don't have the energy, feel like they don't have the energy to exercise. But there are studies that showing that exercise helps. And here at Fox Chase, we offer a cancer fatigue program twice a year. And that's a program that educates patients on how to properly exercise, how to fight the fatigue symptoms related to your cancer and treatment. There are also other psychosocial needs and the financial concerns. And here at Fox Chase, our social work department are really helpful. They reach out to patients to see what their needs are and provide resources. There are financial counselings here too if patients are having issues with their finance of cancer care. So last but not least is your primary care physician. Many times I kind of feel like we as an oncologist in here at Cancer Center and taken some of the role of primary care when we are actively seeing patients. But ultimately, our goal is to deliver you back to your normal life, and your primary care physician should always be the one that you maintain a good relationship. We try our best to communicate with them of our care, and we always send our note to them And we hope to have a collaborative relationship with your primary care, because not every patient lives in the close proximity to Fox Chase. Sometimes issues can be taken care of by your primary care doctor or initiated care with your primary care, and then we can communicate and provide better cares for patient. And as I said, the ultimate goal is to transition you back to your primary care doctors who will take care of all aspects of your care, including cancer surveillance. So some of the resources, I know many patients wanted to know where to find reliable resources. So American Society of Clinical Oncology, ASCO, has a guide called Answer Cancer Survivorship Guide. It's a 40-some page booklet that you can download. It's free online, talk about cancer survivor issues. Cancer.net is another good resources. And here at Fox Chase Cancer Center, we have we have part of the website devoted for cancer survivor care. So you can go online and find that information. And also Melanoma. I went online last week during my preparation of the talk, and I found that they have very good information. Another good organization that we always have collaboration with is Melanoma Research Foundation, and they also provide really good information for melanoma patients regarding the care, all of the questions that you wanted to ask. So as I said, our goal here at Fox Chase Cancer Center is that when you have an active diagnosis of melanoma, we are walking alongside with you throughout your treatment. But the ultimate goal is to deliver you through cancer diagnosis and back to your normal life, back to the community, and back to your daily routines, and have a good care in the community with your primary care physician. So this is the last part of that video that I was talking about, and I think it's really summarized the goal here for survivor care.
Look at me.
Many cancer patients and survivors tell us that having cancer was the most important and valuable and life-transforming experience that they've had. It's paradoxical that something that is life-threatening could do this, but the inner strength and the power that some individuals feel by having conquered cancer allows them to move forward and do so many other things.
The goal is to return the cancer survivor to as normal a life as possible, and to reassure them that their care will be optimal and that the medical system will be there for them when they need it. And we can do that.
I think the key point is that we have to decide that we're going to do it. We have to pay attention to the patients and what the patient's needs are, and we have to make sure that we develop standards.
We've been able to treat cancer in a better way, such that now 10 million people do live with cancer, then surely we can muster the energy so that we can tend to the quality of life concerns that these people will face.
I need to know what to expect after treatment.
I need follow-up care.
I need my doctors to communicate with each other.
I need to be covered by insurance.
I need to be treated fairly at work.
I need to believe I can have a healthy future.
All right, so that's the end of my presentation, and thank you for coming here. I think what patient was saying by the end is also our goal to here for cancer survivor care is that we can provide a comprehensive care for patient and really deliver you back to your normal life. Thank you.